For this week's Starting Line, I'm Sarah Allen. Anyone who's ever stayed at a hospital or had a loved one stay there knows the importance of discharge care instructions. You don't want to leave a hospital without knowing how to change the bandage, what time medicine should be taken, or if medicine should be taken with or without food. Representative Nick Zerwas, a Republican from Elk River, wants to make sure that hospitals are giving these important care instructions to the person who will be providing the primary care of the patient. A frequent patient himself with 10 open heart surgeries, Representative Zerwas is sponsoring a bill to better equip caregivers and patients with knowledge that helps lead to a successful recovery at home. Thank you, Representative Zerwas, for letting us talk to you about your bill. Can you describe what your bill would do?
Right now, what we're seeing really over the last 15 or 20 years are hospital stays being shortened and more people doing recovery at home. And so as that occurs, more of that care, that after hospital care is falling on generally a family member, so a spouse or a child or a parent. And it's getting more and more complex, new medications, maybe changing bandages on an incision wound, being sent home with IVs or catheters. And so we want to make sure that as people are sent out of the hospital, there's one person that's designated to get the aftercare instructions and the new information, and can then provide that follow-up care. And then the other important component is that we're requesting that upon discharge, all this stuff is covered with that identified caregiver, and then a phone number is provided for if a day or two later they have questions. I'm not really sure if I'm supposed to do, change this dressing, or did we get all of our meds for day one, and do I start the medication again tomorrow? Because a lot of times there can be confusion. You get home and you have a question, should I call my primary doctor? Who at the hospital should I try to track down if I have a question there? So this is just trying to streamline that process. And really the gist of it is, under the ACA at a federal level, hospitals are being graded, and then eventually reimbursement rates will be based on hospital readmission rates. And so this is working to drive down hospital readmissions to kind of to stop preventable stuff from sending people back into the hospital just because an elderly caregiver or a parent didn't know what steps to follow to take care of their loved one upon discharge, or just a simple resource to reach out to if you had a question about taking care of your loved one.
So what happens now, and why is there a need for this bill?
So currently, it's a little bit more piecemeal, where you might get you might have an incision where they'll change the dressing once in the hospital, and the nurse or whomever will walk through. If you have a visitor, if your spouse is there, if you have a child there, they'll walk through the process with you and with that individual. And then if it doesn't happen again before discharge, they'll still mark it down on the chart, gave direction for wound care, but those directions may occur to several different people, and perhaps none of those being the final caregiver upon exiting the hospital. And so we're trying to coalesce what a lot of hospitals are already doing and making sure that primary caregiver upon discharge gets all of this information given to them.
Can you tell us why you are sponsoring this bill?
Well, for me, this bill resonates. I was born with a heart defect, and so I've had 10 open heart surgeries, multiple hospitalizations, sometimes for 5 or 6 months at a time. And there were times, especially when I was waiting for the heart transplant, that we were sent home. I was 15 years old. I was sent home with a tube through my chest wall into my heart with a IV pump. And we had a nurse say, okay, you pull this bandage off, you swab this, you put that back on, and you're good. And the cartridges for the IV plug in down here. And she said, Mom, does that look good to you? And then we got home and we're like, oh gosh, what do we do? And so I've kind of seen the extreme end of it as a patient, and then I put myself in the shoes of an 86-year-old woman who is now being asked to care for your 88-year-old husband who's being discharged after a stroke or after a cardiac arrest. We need to make sure that we spell out those care instructions step by step and then provide resources and a phone number for those questions to be answered afterwards.
Can you tell us where this bill is in the legislative process?
Yep, so it's been introduced in both the House and the Senate. It had its first hearing in the Senate earlier this week. And we have a hearing request submitted for health reform. And I'm very hopeful that we'll have a hearing on health reform and move throughout the process.
Coming up next week, Starting Line will feature a new bill and look to see if there's been any movement on Representative Zerwas's bill. And remember, hundreds of bills get introduced every legislative session in Minnesota. All of them first have to cross the starting line.